Secretary Finley, in your written testimony, you were referring, you may have done this in your oral as well, refer to the reference guide. Does the DoD plan on making the reference guide, do you plan to make it available on the web so that small business owners know exactly what contracting officers in the field are utilizing when they're determining emergency contracts?
Yes, sir. The guide has been going through numerous. Have a copy of the latest updates here. It's been going through what they call red team review. Will be on the web. It's gotten inputs back from the Air Force, the Navy, Marine Corps, and the Army. We plan to post this, on the website this week, and start to get feedback. And the first edition of this is planned to be issued on or around 1 September this year.
Good. Thank you. I think it's important to let the small business community know exactly as much as possible so they're able to bid and that sort of thing.
Yes, sir.
Secretary Preston, last year storm forecasters predicted a more active than normal hurricane season, and of course, as we know, no major storm made landfall in the U.S. How difficult is it to be fiscally responsible with an employee budget yet maintain appropriate readiness for a major disaster on the level of Hurricane Katrina or Rita or other major disasters that we've had, or a major earthquake, for example, in California?
Well, sir, it's a balancing act. I do think it takes money to be prepared, but I think there are ways that we have looked at preparedness that we think are fiscally responsible, but also, and most importantly, ultimately will be sensitive to the people that we're here to serve. I think it hits in two areas primarily. It hits in, well, probably three. It hits in having a systems capacity to handle the volume with your computers. It hits with facilities, having backup facilities to be able to put people, because we ramp very quickly. And then most important and most challengingly, it deals with people. And what we have done in those areas is we've already expanded our systems capacity fourfold. So it's been dramatically expanded. We have a very specific facility expansion plan with currently active facility, active backup facility, and then we also work with people at the GSA every month to understand what's available in the federal network should we blow through that, which would only anticipate an event much bigger than Katrina. And what we've never done before is dramatically expanded our reserve corps. That does cost money. It costs money to bring people in every year for a week and train them. But those are people that stand ready to come and serve. We've significantly expanded our lending training for people who are not in our disaster business elsewhere in the SBA. That costs money, but we think it's a very frugal way because we're identifying people, training them, but not fully employing them at this time. And you really have to kind of understand how that ramps with the needs. But I think we've done a good job of balancing that.
Thank you. And finally, Mr. Hankey, since you lived in Cincinnati, what I should ask is, do you miss more Skyline Chili or Grater's Ice Cream or La Rosa's Pizza? But I won't put you on the spot for that.
All of
the
above.
Ask,
all of the above, sir.
is if a similar event to Katrina occurred either in the Gulf Coast region or elsewhere, how would the VA's response differ from the response in Katrina?
We have taken a look at our emergency contracting procedures and are trying to establish a core competency in the acquisition of workforce to handle that. If you look at VA's response to Katrina, we had frankly a remarkable achievement. Our Gulfport facility was completely destroyed. It was planned to be consolidated with the facility at Biloxi anyway, and we moved ahead and are now rebuilding or expanding our campus at Biloxi, Mississippi. But the VA care providers in the hospital in New Orleans, there are many of them who stayed in the bed tower in the hospital in New Orleans, tending to their patients and evacuating their patients as they could, and they could see from the hospital tower where their own homes had been flooded and had been destroyed. So we're actually quite proud of our performance and our response. We didn't lose a single patient, and many of them were on critical care. but we did extraordinary things to evacuate them to safety. We quickly established 3 new community clinics in Hammond, Slidell, and Laplace, Louisiana, to reestablish the VA presence in the area and start to provide that care. And the workload for VA, for veteran patients, is showing up and is reappearing in the New Orleans area. So we're very proud of what the VA employees did in that region.